Hey guys, I'm going to try to make this as quick and painless as possible, but based on what I've seen in class recently, I think we could use some time reviewing some of the key basics of the muscular system. So the muscular system actually includes muscles that attach to your bones, but what you may not know is that you also have muscles in your digestive tract, in your blood vessels, and even in your heart. So the muscular system includes all of those, and also the connective tissue that attaches your muscle to bone. So those tendons that we've been talking about in class, those are also part of the muscular system. There are three main muscle types. The first one is smooth muscles. Smooth muscles can be found in your digestive tract and your blood vessels. Then you have cardiac muscles. These are special because they're only found in your heart. Cardiac, again, meaning heart or referring to heart. Then the third type is skeletal muscles. These are what actually help your bones move. They also help protect your inner organs. If you think about it, your abs are a protection for a lot of your digestive system. So there are two main types of movement. You have voluntary and involuntary movement. Voluntary, you have control over. Like I can choose when to blink my eyes. I can choose when to move my mouth and make sounds. Involuntary, however, I have no control over. I can't control when my heart beats. I can't control when my blood vessels contract. That's just something that's a muscle action that I have no control over. Your muscles are actually connected to your bones with a really tough connective tissue, kind of like a really strong elastic band called tendons. These are what connect your skeletal muscles to your bones. Now, don't be confused. Ligaments are what join or bind your bone to bone, but tendons are what actually bind your muscle to your bone. Muscles oftentimes work in pairs. So this is convenient for a big reason that it causes smooth and controlled movement. When we have pairs, they work very well together in a nice flow. Like it's not awkward or disjointed. The pairs have two parts, the flexor and the extensor. Now the flexor, the way to think of this is that when you flex your arm to show how big your bicep is, you are bending part of your body. The extensor is the opposite. It's actually extending or straightening part of your body. Okay, so the deal with muscles is if you don't use them, they actually become small and weak. So if you don't use it, you will lose it. If you exercise, your muscle will actually become stronger and larger because you're increasing the blood flow to the muscles as the muscles contract. Now, there are two main types of exercises. You have resistance exercises, which are the most effective for actually developing the size and strength of your skeletal muscles. And these exercises are where your muscles have to overcome some kind of weight. So it can actually be weights, or it can be the weight of your own body. For example, doing sit-ups or pull-ups, push-ups, anything that require you to overcome the weight of your own body, that would fall within the resistance exercise category. Now, resistance exercises are really, really good for building up your muscle. They're not great for your heart, though. What's great for your heart are aerobic exercises. Aerobic exercises, yeah, they increase the size and strength of your skeletal muscles a bit, but really what they're doing is strengthening your heart while increasing endurance. So these exercises include jogging, cycling, skating, swimming, fast walking. These are all categorized as aerobic exercises because they're really getting at strengthening your heart. Now, there are many ways to injure your muscles, but we're only going to really be talking about two. First one is muscle strain, or just overstretching or even tearing of a muscle. This is also called a pulled muscle. You can also damage your tendons, and these will actually become hot or inflamed as it's trying to heal, and that's called tendinitis. Do I want to say anything about that? Oftentimes, surgery or an extended period of rest is required for a tendon to heal. Okay, anabolic steroids, these are the last things we're going to talk about. These are pretty darn dangerous. Now, these are hormones that are used to make your muscles bigger. They are actually chemicals that resemble testosterone, which is the male sex hormone, And what it ends up doing is giving players an unfair advantage in sports. Now, not only is this unfair to other athletes, it also causes serious health risks. It's actually very dangerous for your heart, your liver, your kidneys. And if you're not fully grown yet and your bones aren't mature, it will actually stop your bone growth. Okay, that's all I have for the muscular system. Please let me know if you have any questions, and we'll do our best to answer those in class. All right, best of luck.